We'll be starting in a minute or so. We're just waiting to see if anyone else joins here live. All right, we're gonna get started, everyone. Today is June 6th. The time is 6:34. This is the Housing Committee. My name is Rich Reynoso. I'm the co-chair. I'm joined by
Robert Press, committee member from the community.
those online who are on the committee, please announce yourselves.
Stacy and Dillian, member of the committee.
Okay. Anybody else who may not be on camera? I think that's it.
Is that Veronica?
Veronica, introduce yourself as, since you're here live. Thank you for joining us. You're on mute.
Hi, Veronica Castro, Acting Chair, Community Board 11.
All right. Review of old minutes. Don't think we have that handy, so we'll pass that section for now. We're going to get right to it. For today's agenda, we have a DSS presentation regarding the Blondell Avenue Homeless Shelter. If DSS is on and would like to introduce themselves, that'd be great. Maybe not. There we go.
Hi, I'm not from, okay, can you hear me? I'm not from Chris, there you go.
Hi, yes, I'm wondering actually if Jocelyn's on, but maybe she's running a little late. Hi, I'm Chris Gonzalez. I am from the Department of Social Services, and we're happy to be here to present on this new facility in the district.
Awesome. Should we wait for Jocelyn, do you think, or?
I am texting her, but actually, I think I think we can just move on to the presentation, so I can pass it on to the provider.
Okay.
Chris, we're also I don't know. I think maybe it's using WebEx. Maybe they're not used to it because I don't have anyone from my team on here right now.
Okay, yeah, we're missing a couple of key people.
I don't know. It's kind of odd because I feel like all of us would be on at the same time, but it must be the new platform or the different platform. Would you give me just a second to call and see if I can get a hold of someone?
We'll take a pause. Everyone will get water. We'll be back in 30 seconds.
I was in a totally different waiting room.
Yeah, and
I'm on also, Natalie.
Oh, Ron. Hey, Ron. Okay, perfect. Well, Jerry, I mean, we have our team here. I don't know, Chris, if you want to wait for Jocelyn too.
Yeah, no. Let's move forward. Absolutely, you guys should feel free to start.
Okay.
All right, Jeremy. Sorry about that, but since we are sort of talking, I'm Natalie Ansariano. I'm the Director of Policy and Advocacy at Care for the Homeless, who's going to be the provider of the shelter that we're talking about today, and then my two colleagues are on here as well that are introduce themselves. I'm George and Ron.
Hi, George Nashak, CEO of Care for the Homeless. Thank you for giving us this time this evening. We appreciate it.
Ron Lawson, Chief Operating Officer, Care for the Homeless. And as George says, thanks so much for your time tonight.
Thank you guys for joining us.
So, Jeremy, we have a presentation that we put together that I could share the slide deck to, and then George will provide if we're ready for that, or if you anyone else we should be waiting on.
Well, my name is Rich Reno, so I'm the co-chair. Jeremy is
Perfect.
on. No worries. He's away right now, so we're running the meeting. Feel free to share. And we'll be here.
Yeah, this is the committee.
Yeah.
Jeremy's district manager.
Yeah, Jeremy's the district manager. Yeah, with the committee. But no, feel free to share. We're all here that needs to be here.
Okay, great. Sounds good. I'm gonna try sharing the slide deck, and then George will have you start with that. But let me see. So I'm doing this through my web browser. I don't have this app.
While you're doing that, I just have a quick question for Rich. Rich, do you have a quorum in person?
We do not have quorum. No, not by any means.
Okay, I just want to make sure that we let that be known. that
Okay.
We're having a meeting, but we don't have a quorum.
Correct.
Okay.
Yep. No, thank you for
Thank
bringing
you.
that. We definitely do not have quorum.
So nothing can be voted on.
Yep.
Is that showing?
No.
It's
No.
not showing. Okay.
If someone else has it, they could share it.
I think we're all going to have the same issue, but let's see if that worked. All right, how about now?
Yep.
All right. George, did you see that?
Yeah.
Okay.
So again, thank you for giving us the time this afternoon. We thought what we would do is begin with a little bit of a presentation that hopefully will address quite a number of your questions. And then, of course, at the end of this, we'll be happy to answer any additional ones that you have, but we thought this might just be an efficient way to get this done. So once again, I'm George Nashek. I'm the CEO of Care for the Homeless, and we are here this evening presenting on the Blondell Avenue project. Next slide, Adeline.
Is it on the agenda right now?
No,
Then we are looking at
it's still
different.
on the
We're-
still on the title page.
This is so weird. Okay. Do you see any of that moving?
No.
Nothing moving.
Hmm. I
Maybe
don't.
Maybe stop sharing and share again.
Yeah, I'm gonna try that again because it is definitely moving on my end.
Okay.
Hmm.
Natalie, do you want me to try sharing?
If you want to try, George, I just don't know that this is gonna work. Okay, my window, Microsoft Edge. Let me try one more thing.
Okay.
I'll just do it directly from the Google file.
Now we got the title page.
Okay.
All right.
Okay.
Very good.
Perfect.
Thank you.
Okay.
Sorry for the delay.
Apologies.
So just a quick agenda of what we wanted to run through this evening. We just wanted to very briefly introduce you to Care for the Homeless. If you don't know about our history and where we come from and the services that we provide, we want to let you know what our mission is. We'll describe the network of community health centers that we operate in New York City. Our shelter services, of course, very relevant to this conversation. We'll talk a little bit about the Blondell Avenue site and the construction, and talk a little bit about how we intend to be good neighbors in this program to your community. So we were established in 1985. We were one of the original grantees of the Robert Wood Johnson and Pew Charitable Trust's Healthcare for the Homeless projects. And I like to say that this is one of the few examples of a philanthropic exercise that actually got funded by government. It was so successful in New York and in 18 other cities that in 1987, the federal government used it to develop the Healthcare for the Homeless program, which was under the umbrella of the federally qualified health center program. And there are now across the country more than 250 grantees. We are one of the larger programs in the country, but this is a wonderful program. It's got a huge amount of support from both sides of the aisle, and we are very proud to continue to be recipients of the HRSA funds that allow us to continue to serve people without insurance and really anybody who walks through our door. Next slide, Natalie.
Is that not going again? 'Cause
Nope.
it's on the next slide. What?
Well,
I don't know if
while
anybody
Natalie's
else
trying to
sees it,
fix
but
that, I'll
it's
kind of walk.
buffering.
I'll try to walk you through some of the content.
Are you
So, what's that?
seeing that? Did you say, Ron, are you seeing now it's under health services?
No,
Is it moving?
it's
Nope.
still under history
Still
for
history.
care, but on my screen it's buffering. I don't know if it's buffering for everybody else. I don't know if WebEx that's causing the issue.
Maybe it takes a little bit of time. It's so odd. All right, I'm gonna stop sharing and I'll go back to that same slide if you want to keep going, George.
So a little bit about our mission. We've really got three key pillars to the organization. We are a provider of healthcare to people who are homeless and unstably housed. We started about 18 years ago to develop residential programs because it was our view and the view of DHS that we needed to integrate health services into residential programs. And so we started a shelter, in fact, in the Bronx, 1921 Jerome Avenue, to integrate a federally qualified health center into a DHS transitional residence. And we continue to operate that program to this day. So we've got the healthcare portfolio, we've got the shelter portfolio, and we also do a significant amount of work in policy and advocacy. And in that arena, we try to contribute to the public conversation about solutions to homelessness. I think we all on this call are aware of the fact that there is a significant negativity in the press and in the public debate about homelessness, and we really feel a responsibility to step up and talk about the solutions to homelessness that we produce. And so that's a main, and also to advocate for additional resources for people experiencing homelessness. And so that's the main mission of our policy and advocacy division, which Natalie happens to head up. Next slide. So we are currently at 26 federally qualified health centers. We are now in all 5 boroughs. In certain instances, we are providing healthcare in programs operated by others. In other places, it's programs operated by Care for the Homeless, like the shelter I just mentioned. And we also are developing some standalone health centers as well. And this is extremely important to us to create this level of access to healthcare, because the people we serve have so many barriers to healthcare. Just think about their transients for a second. So a gentleman experiencing homelessness may come into the 30th Street Assessment Center. He may be there for 6 to 8 weeks, get transferred to a mental health shelter in the Bronx. He may be there for 9, 10, 11 months, get transferred to a permanent supportive housing program in Brooklyn, and may hopefully stay there for years. If we're not in multiple locations, if we don't have a robust ambulatory care network, we're not going to be able to provide the longitudinal health care that that person deserves and that we want to provide. And so that really has become our model, the creation of an ambulatory care network across the city. At each of the nodes of the network, we provide comprehensive primary and behavioral health care. And at some of the nodes, hopefully an increasing number of the nodes, we're also going to be providing dentistry services, because there are very, very few folks in the healthcare world in which we operate that are providing dental services. A very reasonable question that we're asked all the time, New York City is the most heavily medicalized city in the world, probably. Why do you need a separate healthcare system for people experiencing homelessness? Well, in fact, we do, because the folks that we serve are not well served by the mainstream health system that serves, hopefully, all of us on this call. There are barriers to care for people experiencing homelessness to get services in emergency departments and hospitals, and there certainly isn't much of a community healthcare network devoted to them, except for the work that we and our colleagues do to provide that. And so we are an organization by mission and also by regulation, since we're a federally qualified health center, that we provide services regardless of documentation status or ability to pay. We really are a place where someone can just simply walk in and get health care. Next, please. Just to give you kind of a benchmark of where we are from a volume perspective. So we served over 11,000 patients last year in our health centers. That's in addition to the people we serve in our shelters. And we provided nearly 39,000 episodes of care visits to those 11,000 plus consumers. I won't go into great detail here because it's quite a detailed slide, but this is just a map of where we are in the 5 boroughs. You can see that our ambulatory care network is strongest in the Bronx, and in fact, the Blondell program will give us another node of care in the Bronx, but we are growing in Brooklyn, growing significantly in Manhattan. We now have a footprint in Staten Island. We are the healthcare provider for the Project Hospitality Drop-In Center and Street Outreach Program. We'll talk about a couple of other programs that we're developing in a few minutes. So in 2008, we began operating Susan's Place. As I said, that's 1921 Jerome Avenue, 200-bed women's shelter for women living with mental health issues and physical health issues, on-site Article 28 federally qualified health center. About 4 years ago, we opened the 52nd Street Women's Center, a replication of Susan's Place and Hell's Kitchen in Manhattan, 120 beds. And then following that, we began to become more involved in the services to people living on the streets of New York City. And so we opened the Morris Avenue Safe Haven across the street from Lincoln Hospital. That's been up and running now for over a year, 120 bed Safe Haven, again with an on-site health center. Then most recently in East New York, we opened another shelter for homeless men on Liberty Avenue, and that's been operating now for about 8-10 weeks. Blondell, we hope to open in August of this year. We're coming close to getting our temporary certificate of occupancy and getting all the regulatory sign-offs that we need. So we're thinking at this point that a reasonable expectation will be an opening in August of 2024. And then we have another safe haven, a replication of our Morris Avenue program to address the street homeless crisis in Lower Manhattan, 120-bed safe haven on East Broadway in Lower Manhattan in Chinatown. That will also have a public open access health center, and we'll also do dental services there. And so each of these sites provide social and healthcare services. And really the goal of all of our interactions with our clients is to get them into permanent housing as quickly as possible. We don't believe that shelter should be the last stop on the journey. We believe that it is a useful modality, but that we really want to get folks into permanent housing. And that is certainly a perspective that we will bring with us as we open the Blondell Avenue program. Next, please. So what are the shelter services that will be provided in addition to the healthcare services? So on the healthcare side, as you might imagine, we'll have primary care. We will have psychiatric care. We'll have different nurses and support staff. On the shelter side, we will do case management. We've got clinical social workers, housing specialists, recreation specialists to really create a healthy and a productive relationship with each of the people who will be living in the program. Next, please. And so the interesting thing that we'd like to share this evening with you is that, and I've been doing this work for a long time, pushing 30 years. This is the first purpose-built shelter that I have been able to work on. This has been ground-up construction. Most shelters, as you guys are undoubtedly aware in New York City, are adaptive reuse. We take a building that's been something else, we turn it into a shelter. Sometimes that works very well, sometimes it works marginally, but this is a program that was designed explicitly to be used as a shelter and social services facility. And so some of the things that we built in here to make certain that we are providing a facility where people are not going to be impacting the community We've got 2,000 square feet of recreation space. We'll show you the roof deck and roof garden in a minute. We have a computer lab with workstations for folks. We have additional recreation space, a lounge area, additional garden space. We've got a 2,000 square foot dining space where we will provide 3 meals per day. We'll have a full-time recreation coordinator who's going to keep folks occupied during the day, although we also want folks to be working on their permanent housing applications, et cetera. And so what we really want to do is focus on health and wellness, but also be certain that we've got enough stimulating recreation activities in the building so that people are going to be using those services in the building and not hanging out in the community. Next slide, please. So this is a couple of recent photographs. So you'll see the dormitories on the left. It is a congregate program, meaning that people will share dormitories, although what we do is we build these privacy barriers to make certain that folks are comfortable and that they've got some privacy, they're not being treated disrespectfully. And then the roof terrace that I mentioned a little bit earlier is on the right. This is on the top of the building, obviously, and we want to make this as attractive a place as possible so that when people want to kind of chill out and just hang out, they'll have a very comfortable place to do that. So that's kind of the state of where we are at the moment. We're still completing a little bit of the polishing and construction work, but we hope to have a TCO fairly shortly, as I mentioned before. Next slide, please. One thing that communities are completely understandably concerned about are the security plans. As I said, we've got a long track record of providing shelter services, and so we've really got a lot of experience building and operating security plans. We'll have 24/7 security coverage, 365 days a year, of course. On every 8-hour shift, we're going to have 3 licensed security guards plus a security shift supervisor. That's on each of the 3 shifts over the 24 hours. We have moved in the direction here of the security staff being direct employees of Care for the Homeless, not a contractor, not a vendor who's providing people who are not connected to the building. The reason that's important to us is that we can train those folks in the skills that we want them to have. First of all, to treat our residents with enormous respect and dignity, but also to have the skill set of crisis de-escalation and redirection that are really important when dealing with people who are experiencing homelessness. We've got a comprehensive CCTV system throughout the building, cameras that will be in the building, plus the exterior perimeters of the building. We will have routine patrols inside and outside the facility. Again, all of this is to keep our staff, our residents, and the community safe and getting along well. And we will, of course, be making certain that we are not allowing the residents to have a negative impact on the community. The other thing that we've added, which has been a nice innovation that technology involves, is that the central management of Care for the Homeless, can remotely access the feed from these cameras. And so Ron Lawson, who's on this call with us, he introduced himself before, he can sit at his desk at our central headquarters on 33rd Street and see what's going on in any of our facilities. Next slide, please. So again, we've learned over the years some of the techniques that will help us be good neighbors within your community. So the first thing we do when we begin to start these programs up is we're going to establish a relationship with the local precincts neighborhood coordination officers. The NCOs are critically important to us. We want them to know us. We want them to understand what kind of program we're operating here. That relationship with the local precinct is critically important to us and to your community. We want to have a routine communication channel with the community. And so we will be inviting all of you, if you choose, or your colleagues, whoever would like to join a community advisory committee. And that committee will meet generally at the shelter, although we'd be open to meeting elsewhere, to just keep a kind of a pulse of what's going on and what any impact we're having on the community so that we can get on top of that right away. Our experience has been that the community advisory committees meet fairly frequently at the beginning of the launch of a program. So they might meet monthly or every other month at the beginning. And very quickly, the committee members themselves say, we don't need to meet that frequently. In fact, our 52nd Street shelter, we had started meeting approximately every month, and the committee said, no, we can meet once a year at this point. That's enough. And of course, special meetings should the need arise. We will have a phone number that folks will call. It's a landline in the building that will be picked up by a human being 24 hours a day, 7 days a week. So if someone sees something or is concerned about something, they'll be able to have a direct pipeline rather than calling central office and it taking us hours to respond. You'll have a human being who'll pick up a phone at the site at the point at which you call to be able to intervene in that situation immediately. And of course, the shelter director will be available, and you guys will have the shelter director's phone number and be able to contact him or her and set up a meeting very quickly as needed. And we expect our program leadership to participate in community board meetings. We expect the shelter director to attend either the housing or the social services committee of the community board, your choice, periodically, just to check in, let you know what's going on in the program, and listen to any feedback that the committee members or the public may have. Next slide, please. And so that's kind of just a general overview, and we're really very happy to answer any other questions that you guys may have.
All right, thank you very much for that. That was very, very, very helpful and in depth. I think I'm gonna open it up. Second, we have someone joining us. Hey, you have any?
You start, Judy.
I don't have any questions. I think it was super in depth. I think the only question I have is, how do you get paid for, let's say, the Blondell Avenue? How does this work? Is DSS the one providing? Can you give us some transparency into that?
Yeah, of course, absolutely. So we have executed a contract with the New York City Department of Homeless Services. It's a cost reimbursement contract that we provide a budget every year to DHS, and then we submit invoices on a monthly basis to be reimbursed by DHS. So that's on the shelter side of things, a cost reimbursement contract. On the healthcare side, we are going to pursue an Article 28 license in this facility. We don't have that secured yet. But that Article 28 license will give us the right within New York State to bill Medicaid. So those folks who bring health insurance with them, typically it's Medicaid, although many people now have Medicaid managed care, will be able to bill Medicaid for the services that we provide.
It's helpful.
Okay, you said that you want people to move out into permanent housing. How long do you expect people to stay at Blondell?
So I can speak from our experience in other shelters. I mean, we don't know yet about this one, but our experience in other shelters is that we're seeing lengths of stay that range from 10 to 12 months. So folks come in, they get stabilized, we begin to see what kind of housing resources they need to return to permanent housing in the community, and then we get them established. Very often in the case of a shelter like this, we'll be using permanent supportive housing, but we also use the range of housing vouchers that the city makes available to us, of which there are a considerable number, and that's a wonderful program. So, but I would say my estimate at this point would be 10 to 12 months.
Okay, now, you said you want to involve the police precinct. You're in a situation though where you're on the borderline of two police precincts. Your side of the street is the 49th precinct. The other side of the street is the 45th precinct. So I just want to let you know about that. And your own.
Yeah, we're aware of that, sir. And yeah, that's a great catch. And we are aware of that. Our main relationship, of course, will be with the 49th precinct. But given where we are positioned, we're going to have a relationship with the 48 as well.
45th.
45th, I'm sorry.
One final question. Were those rooms that we saw with the with those wooden barriers there or whatever, and how many people will be in a room, if it is a room?
Ron, what's the range of dormitory size in the program?
Yeah, on average, 12 to 16 per dorm room, and on 2 floors of the building.
That's it.
Okay. I'll open it up to anyone online. Veronica, if you have any questions, feel free to ask. Anyone else from the committee? May I, Stacy Ann, if you have any questions, and then I'll open it up to the public.
I do have a question. How are the people that are going to be in the shelter? Are they chosen a particular way, or anyone who happens to be homeless, the assistance can join?
You know, we would like to prioritize the people who are living unsheltered in your community, because obviously there's a value to keeping someone in the same community. So to the extent possible, we'd like to make these beds available to the folks who are living on the street in your community. But typically, referrals are made to us through the Department of Homeless Services. And so there's a central point of intake for homeless men at 30th Street and First Avenue in Manhattan. People come in there and they receive an assessment by DHS, and then they may be assigned to our program. One advantage we have that we bring to this project is that we are the healthcare provider at the 30th Street Men's Assessment Shelter. And so if we begin working with George Nashak at the 30th Street Assessment Shelter and he gets assigned to the Blondell Avenue Shelter, we've already got a comprehensive medical assessment on him, and we can provide continuity of care when he arrives at the Blondell Avenue Shelter.
So if someone from the area here in this community needed help, they'd have to go down to the assessment facility in order to be put into this facility?
Yeah, typically DHS wants to perform an assessment of that person. By the way, this is going to be a healthcare center that is open to the public as well, or to all eligible people in the community. So we can begin serving that person in our healthcare operation at Blondell, and then assist them to get down to 30th Street and hopefully get assigned to Blondell as their shelter placement.
And one more question. I know that this is a concern for some of the community members. During that assessment, is a background check done regarding any criminal history that they may have that may be of concern to the immediate area, like children or women?
I'm happy to answer that, but I'll defer to my colleagues from DHS.
Yvonne, do you want to take that one?
Hi, how are you? No, there's no background checks done on any of the clients that come into our system. We follow the state regulations as far as where a person may live if there are restrictions upon that person.
How do you know if there's restrictions on them if you haven't done a background check?
We have a relationship and a MOU with Department of Corrections. So if someone has living restrictions on them, we will know because they'll refer them into our sites, and we will know where their restrictions are and what those entail.
Okay, thank you.
Mhm.
That's all I have right now, Rich.
All right.
Thank
you,
you,
Veronica.
Veronica.
I'll just pop in. Stacy Ann, do you have a comment or question?
No, I was just gonna ask about the background check, but she did.
Okay. I'll open it up to the public. If you could raise your hand, then I can call on you. That'll be easiest. So if anyone from the public would like to speak or ask.
I'm not really sure how to raise my hand on this.
Sandy, since you're already going, you go ahead.
Okay, thank you. I came in a few minutes late, so it's going to be homeless single men, approximately 200, correct, as the original plan? Yes?
The capacity of the program is 200, no more than 200. That's right.
Yeah, okay. Well, we're very concerned in the community about this, and I'll tell you why. There is another one being built about 10 minutes walk from there with the same population and the same amount of homeless on Poplar Street. Okay, about 3 or 4 blocks away, there is another homeless shelter. That's a family homeless shelter. A few blocks away, there's Covenant House for homeless teens. Okay, now, I just want to be clear and hope that the community, you'll have some, is there a provision for some kind of a community board or committee for the people running the shelter to engage with the community? Because we had issues with the one on St. Peter's Avenue. There is one on St. Peter's Avenue. where they were going to have some kind of a committee and reach out to the community, et cetera, and that fell apart and didn't happen. So are there any provisions for that? Okay, and I just would like to state, and this isn't really a question, I'm sorry, but I just like to state how concerned I am, I'm from Westchester Squares Area Improvement Organization, how concerned I am with the proximity. And we also, by the way, have Waters Place, where there's a lot of homeless shelters. That's like a few blocks away as well. With the concentration of another 400 single homeless men within close proximity to Westchester Square business area bid, you know, the commercial square, that is already having a lot of problems with homeless population and also drug people who are on drugs. They're on methadone clinic another half a block away. And also that Lehman High School is only a block away from Westchester Square. So I just wanted to say that. But how do you intend to get the community involved in this? Thank you very much.
Sure. Thank you, Ms. Luss, for that question. So in every one of our programs, and this will be no different, we establish a community advisory council in which we invite members of the community to participate. Sometimes people from the community board participate, sometimes a community affairs officer from the precinct participates. We also welcome neighbors or people involved in business in the community. And we will establish that committee as we open the program. And we will be, as I mentioned a little bit earlier, perhaps before you came in, we will start those meetings probably on a monthly basis at the beginning. And we're happy to host them at the shelter, or we can host them at another location. Sometimes the community board likes to host, that's fine with us. But our shelter leadership will be involved in those meetings, and we will meet on a monthly basis for as long as possible until we get the community comfortable. Our experience has been that those meetings become less frequent over time. We will not have them disappear. We will I was mentioning earlier, even we have a program on 52nd Street where we even have trouble getting people to participate in annual meetings because they feel like we've resolved the issues. But we want very much to be in a dialogue, a constant dialogue with members of the community. We also expect our shelter leadership to participate in committee meetings at the community board. We want the shelter director or designee to attend committee meetings, to get feedback from the community and provide updates on the program. We also will have folks will have access to a phone number where they will be able to call the building 24 hours a day, 7 days a week. There will be a landline that will be picked up by a human being so that if there's something happening in an emergent basis, our staff will be able to get right on top of it. So you don't have to call our central office and wait for hours for us to respond. We want to be extremely responsive to any of these problems.
Thank you for that, and be aware, we will be watching and we will be aware. And I'm not a member of CB11, but to the CB11 leadership or whoever's involved, I would like to be on this committee, and I would very much like to be on this committee. And I
We
thank
welcome
you.
you.
I thank you for your answer.
Thank you. Next would be Carl, if you're on. Shoot.
Yes. Okay.
I'll give you a 30-second warning. Go for it.
Anyway, anyway, I'm Dr. Carr. You can hear me?
No, you're cutting in and out, to be very honest.
Okay, can you hear me now?
Barely, but go ahead.
Okay. Dr. Carl Anderson, resident on Blondell Avenue, live very close to the shelter. I'm a psychiatrist by profession, and as you understand, there are just another.
Yeah.
Blondell is a very busy street. There's rushing cars, ambulances. The base is nearby. No places for the shelter residents. Now we're hoping to be like convinced out, but obviously the residents have to be very carefully selected. We would recommend and elderly citizens instead of homeless men. And obviously we can't have people there with severe social psychiatric problems. And I'm glad that you're providing the services. They have to have their psychiatric and substance abuse problems treated. They have to be carefully supervised. They cannot be wandering the streets. You know, this is a very kind community, but, you know, disorderly behavior is not tolerated. There must be a strict curfew. And I'm glad you're having this community board. I think the channel of communication is really important. That's really, really excellent. And then to the members of the community board, you know, we're looking for you to prove your concern to the community by making sure that the community is safe and understanding that any problems, even if this is the periphery of the district, is going to affect other people in the district too. So anyway, I just wanted to make that statement. But again, thank you for your presentation.
Yeah, Dr.
And
Anderson.
actually, I'd like to put, yes.
So thank you for those comments. I wanted to, I'm not sure when you came into the meeting, but I wanted to make certain you're aware. We have built this project specifically with a very large amount of recreation space. We've got a very large roof deck. We've got a garden with for recreation. So we want to create a comfortable environment within the building so that people are not wandering the community. This is not a lockdown facility. It's not a criminal justice facility, but we can use carrots to keep people in the building. And we think, you know, the roof deck that we've created, I think any one of us would very much enjoy sitting in. We do have a curfew, just to answer your other question. It's 11 p.m. So there is a curfew in terms of people needing to be in the building.
Okay, no, good. I'm glad to hear that. And obviously with the recreation space, you know, that's really important. I'm glad you have that.
Yeah,
and,
we agree. We
next,
totally agree.
I'd like to put on Dr. Marianne Lacrosse. She's with me right now, and she's going to speak too. Here she is.
Yes, good evening. Can you hear me?
Yes.
Yes, okay, great. Yes, well, I'm a long-standing resident on Blondell Avenue, the same block as this shelter for 200 homeless men. I've been a resident on Blondell for decades, all my life, my family for 4 generations, and I also have a doctor of psychology. I'm a psychologist, and I know very well all the psych diagnosis. And of course, we help people that need help all the time, you know, as psychologists. They have conduct disorders, antisocial, drug abuse, schizophrenia, psychosis, and other disabilities. So, and there's also, as Sandy mentioned, a very large public school within 2 blocks of the homeless shelter for 200 men with children in it. And so the key point I'm driving home tonight is safety. And yes, I do hear all of your safety recommendations, which are great. But I want you to select the population that you put in there as if you lived in a private house right next to the shelter, and that you're going to be safe. Select the population in terms of it being your private home. And also there's going to be an affordable housing building now put up right next door to this homeless shelter. And it's going to have women and children living alongside 200 homeless men. So I wonder how that's going to work out. I will be attending the meetings that you have for sure. And I also need the contact number, because if I have anyone outside my driveway when I'm coming in and out at 10 o'clock at night or all hours, I will be on the phone. We're giving a report, we're calling the police department, because again, safety is really key. And that's what I'm driving home. So please give me all the numbers and I will attend. You know, you need to keep safety as the number 1 priority, because that's the way it is in this community.
Thank you.
Excuse me. Go ahead.
No, 15 more seconds.
Yeah, well, that's the main thing in terms of, I watch the construction go up every day, even on Sundays. It's on the salient auto wreckage, you know, with toxins and chemicals in the soil, which were probably never remediated. You know, it went up really fast. So we really are concerned, you know, and we will be involved because we're your next door neighbors right here on Blondell.
All right, thank you.
You're welcome.
I think Diana
If
wants
I
to-
may just respond quickly, if you
Yeah,
don't
go
mind.
ahead. Yeah, go ahead,
Thank-
George.
Thank you for those comments. We completely agree with you. I just want to put one misconception to rest. There are this was an auto repair facility, that is correct, but all of the environmental issues and remediated. So I just wanted, I don't mean to contradict you, but I wanted to get you the accurate information. All of any kind of the minor environmental things that were found were completely remediated, and we have to get this signed off by multiple levels of government to attest to that. So it's not just our making an assertion that that happened. We have to have it tested. In fact, this week we're having air quality testing done, and so there is no environmental hazard associated with this building.
Okay, well, that's good to know. I mean, they're living on it, I'm not, so that's fine with me. So that's good that you took care of all that.
But we like homeless people to be as safe as all of us are.
Yes, of course, and that's our profession. We're always helping people that are in need, but again, you know, in a safe way for everyone. We don't want it to be a hot crime spot, that's for sure, on Blondell.
Us
That would be
too.
horrible.
Thank you. Diana, I think you're next.
Yes, thanks. I'm Diana Finch, and I'm with the Bronx Park East Community Association. We're not very near Blondell at all, but we're part of Community Board 11, and we have referred some residents to the 30th Street, well, some relatives of residents to the 30th Street Intake Center. So my questions were about the startup, how quickly you can start the community advisory board, because it sounds like the neighbors really want to be involved from the very, very beginning, and whether the shelter director's been hired yet, and also how it's populated. You know, do you anticipate that you'll be full with 200 people within a week or so of opening, or will it be a much slower process than that? But the main question is more information about how the community advisory board works. And are you the ones who run it, and how do you do the outreach to the community so that members know about it and can participate if they want to? You know, who puts it all together, and can you start it even in advance of actually opening the facility?
So thank you for all those questions. I will attempt to answer all of them, and you'll keep me honest if I miss one. So the Community Advisory Board usually starts about the same time that the program begins, and we're looking at a mid-August or thereabouts opening. But our Director of Policy and Advocacy, Natalie Interiano, who's on this call, will begin forming the committee beforehand. Usually what we do is we impose on the generosity of the community board to make referrals of folks, but we'll have other ways of folks contacting us if they want to participate in the community advisory boards. Very, very important that we maintain that dialogue with the community. With respect to how the building will be populated, we will not have, I'm going to look to my colleagues from DHS, but we will not have 200 people there on day one. What we typically do is we'll start, 5 gentlemen a week or something along those lines, and then it'll take probably several months. I mean, for example, we opened a shelter in East New York 10 weeks ago, and we're only at about 50% capacity at this point. So there is a long ramp-up period, and that's partially because we want to be able to kind of, so to speak, kick the tires on the building and get the staff working as a team together. We are currently recruiting for a shelter director, and by the way, we would very much appreciate the opportunity to put all the job postings, from security to food service workers to case managers, up on the job board of the community board, so that we'd love to have local folks working in the program. But we've begun, we've certainly posted and are recruiting for the shelter director. We've had a couple of folks who we're interested in, but we have not onboarded that person yet. What we will do, however, ma'am, is we will onboard the shelter director prior to the opening of the program. They're not going to walk in on the day that we have our first client. We want that shelter director to be there 6 weeks, 4 weeks, whatever it is, ahead of time to really get the program up and running, to get their team together. And he or she will have that responsibility to make that happen. And I think that was all your questions, but if I forgot, you'll.
Yes, I think it was.
Okay,
thank you.
Good. My pleasure.
George, if you have positions that you would like us to circulate through the community, for if anyone's interested, you can send it to Jeremy Warnke at the community board office, and we can have it distributed out to the public.
Great. Ron or Natalie, could you please follow up with that with our HR department? Thank you.
All right. Anyone else online have a question? We have a couple here, so I wanted to give someone's time for whoever's online. Going once, going twice. Okay.
Now, are you gonna have a committee room that say, for instance, the housing committee can come and have a meeting there with you and anyone who wants to come in from your building or the neighborhood?
Because the shelter is an emergency and crisis response, we typically, this is not like permanent supportive housing. They frequently have community meeting rooms. We don't tend to do that in shelter, partially because we want to respect the privacy and the confidentiality of the people living there. So unfortunately, we won't be able to do that. We will, however, happily tour people through the building if they're interested in what I like to demystify what's going on in shelter. There's no mysteries behind there. I'd like everyone to see what's going on. So we're happy to give people tours of the building. But unfortunately, we're not able to create a community space because of the nature of the program. That's a luxury that permanent supportive housing providers have that I think is a wonderful thing. But because it's a place that people are coming in and have the right to privacy and confidentiality, we don't do those community kind of meetings in our program.
Where will the community group meet then?
Well, that's different. That's a meeting related to the shelter. So we will be happy to host that at our building or another place of your choice.
All right.
George, just to mention, what we've done in the other, and it's worked well, is we've done it via Zoom. So our Zoom meetings, then people can join right after work. We usually do it after 5 o'clock. Especially after the pandemic, I think most people are pretty adept at it, but that's how we've done the Community Advisory Committee for the more recent ones.
And as one person said, right next to you is going to be a new housing project with families in it. Are you aware of what's going to be on the other side of your building?
No, I'm not.
In where the porta potty place was, it's going to be a micro business. That's the second floor, and the first floor will be a retail dispensary for cannabis. They're going to grow some of it on the upper floor and sell it on the lower floor. You're not aware of that?
I am not.
Well, now I'm letting you know. Will that in
Thank
any
you.
way affect?
Thank you, I think.
Will that in any way affect your residents?
Any dispensary in any community affects the people who live there. So I would suspect it will, yes.
Okay, I'm glad you're honest.
Yeah. No, and thank you for that, Bob. That's actually, I mean, thank you for digging into that. Now they know. So, okay, good. Anybody else online have any comments, questions, chat? Again, thank you so much for joining us. I think this is a this is what we wanted. Folks have been asking for this for months, I think. And you guys were very good in terms of the presentation. Yeah, very honest. You guys have done this before, and you know.
Well, it is our intention to be good neighbors and to be to join with this community, become part of this community. So we hope that this is the start of a very honest, straightforward, and productive relationship.
Also, this is being recorded, so folks will undoubtedly go on YouTube as soon as tomorrow, and we'll review this tape because folks may be working late, et cetera, et cetera. So this is on YouTube being recorded. Folks who aren't here will be able to review the tape at another time. So we'll probably have more questions for you after this meeting, but I'm sure you guys will welcome that.
100%.
Okay. Good?
That's it.
All right. I think we're good here. Questions?
Wait, I'm sorry. Can I just say, I know I'm not a member, but I have to just say this. We've heard all this before from DHS, okay? We've heard it before many times. And I just want to, say again that I was a member of this community advisory board on the St. Peter's Avenue shelter, and it fell apart within they had maybe 1 or 2 month meetings. That was it. We even did programs there. We did a magic show. We did arts and crafts and stuff like that. And the advisory board first they started by making times where, like during the workday where no one could go, and then it just completely disappeared. And so please forgive me, but I'm a little skeptical. We've been through this several times in Westchester Square. So please, if you say you're going to have an advisory board, please make it workable, please, for the people around who are concerned. Thank you very much in advance.
Well, the good news, Ms. Lusk, is the people responsible for executing that are on this call. They're hearing you. And as you heard Natalie say before, we try to arrange these things with the lowest barriers possible. We could do it by Zoom, we could do it in person, we could do it in the evenings. So we will make ourselves available to make certain that folks who want to participate can.
All right. On that note, thank you everyone for joining us. It was a very good, effective.
You want to go through any more gallery session?
I think that was it for gallery. I don't think unless anyone else has anything else for gallery besides this presentation, speak up or
Hi,
forever hold your peace.
hello?
Yeah.
I'm sorry, it's hard to hear me. I still have the flu. It's Kate Cardona. I don't have the hand raise feature with this new WebEx
Okay.
feature. Yeah, are any of the people
Okay.
that are going to be in this new shelter, are any of them possibly employable? Can they be taught new skills? And how are they going to commute? That area, if I remember correctly, is not really, doesn't really have much in the way of public transportation. So if one wanted to recuperate or find a path to better mental health and they want to be employed, yes, they want an apartment, but they want to be employed, how would they go about doing it in such a transportation unfriendly environment like that area? Is there some component to your services that includes like job education and stuff?
So thank you for that question, Ms. Cardona. I'll defer to my colleagues from DHS if they want to give a different answer, but my understanding is that a third of the people in the New York City homeless shelter system are employed, which is kind of a striking number, right? And so, yes, we anticipate that some of the folks and people in each of our shelters have jobs. I don't necessarily completely agree with you that it's not well served by public transportation. This site is just a block and a half or a couple blocks from the number 6 train at Westchester Square. And so I do think that one of the criteria that we use when selecting locations, because I also have to get staff there, not just clients, is that we have good access to public transportation. So the number 6 train is right there. And so the people will be able to get about the city using the public transportation system.
Oh, I wasn't aware of that. All right, thank you.
Sure.
There are also several buses that stop by the number 6 train also, so there's plenty of transportation.
Thank you.
All right. Thank you, CSH Care for the Homeless and DHS for joining us. It was a wonderful talk. We're going to go into regular business here at the Housing Committee. We have no motions because we have no quorum. So we'll move on to old business.
There's one item of old business.
Yep. You guys can jump off if you want. By the way, thank you.
Thank you for your time. We
Thank
appreciate your
you.
attention.
Good night.
Thank you very much.
Thank you very much.
Bye-bye.
Bye-bye.
So old business.
At our last City of Yes committee meeting, Ted Weinstein from HPD mentioned the Fine Fair location.
Yep.
Going from 333 units to 400 units.
Yep. I spoke to him about that.
So we're gonna have to, at our September Housing Committee meeting,
Yeah.
bring him in and find out what's going on there.
Yeah.
It seems like they're adding the 20% bump up for the City of Yes, even before the City Council has a chance to even consider it.
So he also mentioned that they don't have to come back to us.
No, they don't, because we've already heard.
Right. So it will just be for informational purposes, right?
Which
So-
the board can do.
Yeah, okay, so we'll look to do that, because they should come back to us, right? And talk to the sponsor, right? Yeah, okay. Okay, good, the September meeting, all right. Any other old business? Diana?
Oh, is this the gallery session?
Oh, yeah, I mean, at this point,
Okay.
yeah.
So I think that last year, if I remember correctly, the community board sent a statement about the rent increases. The rent guidelines board rent increases.
Yeah, I remember that, yes, I remember that.
Yeah, and
Yeah.
this is upon us again
Okay,
with proposed very high increases. I
okay,
am not sure about the timing of the rent guidelines board meeting. It might be before I think it's in June and it may be before the full board meeting.
yeah.
But I was wondering if the board could maybe make essentially the same statement that it made last year about, concern to keep the increases as low as possible.
We can't vote on that today, but I mean, what we could do is
Right,
up
true.
to leadership. I think have it come out of leadership. They could vote yes, and then we can vote at. I think the answer for us is yes. Let's do that again. But we'll bring it up at leadership, have them vote yeah there, and then we'll bring it up at the full board. That way we have it for June. So
Okay,
yes,
great.
to your,
Thank
to
you.
your- Yep. We'll bring it up again. Anybody else? Any old business from anybody else? All right, moving on to new business. I don't have any. I think we're good for now. And that's all, folks. Thank you for joining. I think that was a really good presentation from Care for the Homeless and HS. And I think we're excited to have that community engagement group. I think we should, let folks know about it during our full board meeting. And probably at leadership as well, so folks are aware. But yeah, all right. I think that's all, folks. Meeting.
Yeah, I think we definitely should talk about having a community board member or two on
Yeah.
that community advisory team for that
Yeah.
shelter. I think it would be a good idea, so we could keep on top of things.
Yeah, we could probably assign somebody from housing or whoever wants to join in, and then we could have assignments there.
Maybe even have people alternate if people can't make it all the time, then another
Exactly.
committee member can make it. But at least
Yeah.
have a presence there.
We have a rotation going. Okay, that's a good idea. Okay.
Yeah.
Cool. I'm gonna motion to adjourn.
There is no motion.
I mean,
It's adjourned.
yeah, I know it's adjourned. All right. We're adjourning at 7:34, even though this is not official. I gotta write the times. Thank you all. Have a good night.
Thank you very much.
Right, thank you.
Thanks.
Good
Good
night,
night.
everyone.
See ya.